This is Conversations in the Clinic. I'm Dr. Kelly. Today I want to talk about pickleball elbow or tennis elbow, which is pain on the outside of your elbow. Typically comes from gripping something like a pickleball paddle, let's say. And I like to tell the story whenever I get somebody in here with forearm pain that I was a good student in high school. I didn't love school, but I was a good student. And I remember sitting there one day with my head on my desk and I wiggled my fingers. If you wiggle your fingers but you look at your elbow, you will see and appreciate that when you wiggle your fingers, there's movement up at your elbow. And that was kind of my introduction of like, wait a second, like maybe this is how our body works on this system of levers and pulleys that is our muscle and our bones. So whenever I get somebody who's suffering from forearm pain, probably due to an overuse injury from pickleball or tennis, I show them that. And you can look at it right now. If you look at your elbow, but you wiggle your fingers, you're going to see there's movement. Same thing. If you move your wrist up and down or left to right or twist it, there's movement at your elbow. And the elbow joint doesn't move, but the muscles that start at your elbow are controlling your fingers. And I've talked about this before. Little muscles do little movements. Big muscles do big movements. It's not rocket science. So when we get an overuse injury, like a pickleball elbow or a tennis elbow or a golfer's elbow or a runner's knee or all these things are named because the people who do them repetitively and don't give their bodies enough time to recover in between sessions. So that's what it is. And when you grip, you recruit all of those muscles that start up at your elbow. So people often say, well, it hurts my elbow. Why are you looking at my wrist and my fingers? Because it's all connected. So that's the first step in looking at what's going on with someone. I'll often look at their shoulder and their wrist and honestly like their neck and their upper back too, because if they're having to grip so tight that they're causing an injury at their elbow, it makes me wonder what they're compensating for. Right? Is there lack of mobility or stability in their shoulder? Is there lack of mobility or stability in their wrist? With a sport like pickleball, it's a wiffle ball. You don't have to wail on the thing to make it go anywhere. Tennis is a little bit different. You're dealing with the physics of a different sport. So that's what happens when somebody comes in with pickleball elbow. The way to fix it is to reduce the aggravating factor. So if it's bothering you every time you play, you have to play less, unfortunately, but that's the easiest and fastest way to fix it. And then we have to treat the inflamed tissue. Because really what it is those tendons. So a tendon is a structure that connects a bone to a muscle. And if you looked at any anatomy chart, the muscles are red, the tendons are white, and the bones are white. And the tendon is that transitional piece where it's not muscle and it's not bone, but it's the thing that connects the muscle to the bone. It doesn't contract itself, but it connects contractile tissue. So it's not a bungee cord itself. It's more like the anchor that you would use a bungee cord with. So tendons can get inflamed, and that spot on your elbow where it hurts, that pickleball elbow, is like I live in New Jersey. It's the Newark airport of tendons. All of these tendons converge. It's a really busy area. It's a small area, and it's really busy with all of the anatomy that has to converge and connect there. So the muscles themselves, in order to work efficiently, converge on this one spot, because if they all do wrist extension or they all do gripping of your fingers, it makes sense anatomically that they would be grouped together and really close together to make your body work efficiently. So in order to reduce the symptoms of a pickleball elbow, you have to calm those tendons down. You have to stretch usually and massage the muscles around those tendons. You have to start to rehabilitate the muscles around it. You have to kind of realign the fibers of the tendon. And that's where we come into play as physical therapists, as we know the direction and the degree and the volume at which to load that tendon so that it responds appropriately, and we help get you better. So that's pickleball elbow. It's not that complicated in the world of injuries. It's not that complicated. That doesn't mean it's easy to solve. It doesn't mean it's fun to rehabilitate, but it's relatively straightforward in terms of diagnosing it and starting to treat it. I appreciate you. Thank you for spending some time and your attention with me today. Keep moving and keep getting better every day.